Hi guys, today's topic is actually surprisingly common. It is when you have a tight pelvic floor or a tense pelvic floor has a difficult time relaxing, but you have a weak core. Now, I recently did a video that talks all about the connection between the pelvic floor and the abs and the rest of the core, and the fact that really no single part of the body exists in isolation from another part. There is a connection between every body part you have because of the myofascial connections and just the way we're built. Now, sometimes if you have a tight pelvic floor, it can make it really difficult to do a lot of core exercises because these muscles in the pelvic floor can get really overworked and overly tense, and they can cause pain. So that makes it easy for the rest of your core muscles to get very deconditioned and weak. So today I want to give you a few simple moves, kind of a simple basic starter routine that you can do if you suspect that you have a tight pelvic floor and a weak core. Now, as always, remember that for specific diagnosis and a specific individualized treatment plan for your needs, it's best to go see a women's health physical therapist or a pelvic floor physical therapist in your area. But this is a great starting point, like I said. So let's go ahead and get going. All you'll need is really nothing, maybe some yoga blocks, maybe a yoga mat, we'll see. So the first thing we're going to start with is making sure that your posture is spot on. I'm not going to spend a lot of time on this, don't worry, but just make sure that when you're sitting, standing, everything, you're not tucking your bum under. When you really strongly tuck your bum under, that really tenses up the pelvic floor muscles even further, and that's not good. So release your buttocks and release your pelvis, and just think of that for your daily life and also as we do these exercises. The next thing we're going to do is think about a pelvic drop or a pelvic release. So I encourage you to either do this sitting or lying on your back. I'm going to sit up, but again, you can feel free to lie on your back. I want you to think about your pelvic floor muscles, and this takes a lot of mental focus, and if you can't get this right away, that's okay. Don't be discouraged, but it's a good thing to practice. So I want you to imagine, we're going to imagine two different things. The first thing we're going to imagine is that your pelvic floor muscles, which are at the very base of your pelvis, and I have a whole video about where your pelvic floor muscles are located, so you can watch that. But the pelvic floor muscles, think of them as a tight little rosebud. And so this tight little rosebud is closed up nice and tight right now. If you have a tight pelvic floor, it's real tight. Now I want you to imagine, and this is just visual here, visual imagination. I want you to imagine that pelvic floor rose opening up into a big, full bloom rose flower. So a rose in full bloom. Now I want you to try to bring some movement into that awareness. So lift your pelvic floor muscles slightly. So tiny little lift, tiny little Kegel contraction. So squeeze and lift just slightly. Bring it, that tight little bud, even higher up into your body, and then fully and completely release as you imagine that rose in full bloom. This is going to feel a bit like a lengthening, not a bearing down of your pelvic floor, but kind of a lengthening of your vaginal area and a little bit of a slight push. Again, not a strong bearing down, but a slight push and a lengthening of the vaginal area and kind of an opening of the increase in the diameter of the vaginal area as well. So try it again. So tight little rosebud, so that'll just be a slight little Kegel, and then the full release, rose in full bloom. Again, feel that gentle push down, again, not a strong bearing down, but very gentle push. Think of a lengthening of the vaginal area, a lengthening of the anal area, thinking of a lengthening and a increase in diameter of the vaginal canal and the anal area. So everything's kind of lengthening and widening. Crazy brain bender, isn't it? Let's try one more visualization that's actually my favorite one. So this is the elevator. So the elevator is where you imagine that your pelvic floor is an elevator. Your elevator doors are probably already closed. In other words, your pelvic floor muscles are already, fairly contracted because they're tight. So your elevator doors are closed. I want you to lift that elevator up to the first floor of a building. It's a tall building, but you're only going up to the first floor, so it's a tiny little contraction. Now I want you to imagine the pelvic floor elevator going down, down, down past the lobby where you started, all the way to the basement. So it's lowering all the way down. Now when you're in the basement, I want you to open the elevator doors. Okay? This goes right along with that idea of kind of lengthening the vaginal canal and increasing the diameter of the vaginal canal. So that feeling is happening as you go down to the basement and then open the elevator doors. Let's try it one more time. So again, elevator is lifting up to the first floor and then going all the way down to the basement. The vaginal canal is lengthening. Now open those elevator doors. The vaginal canal is increasing in diameter. It's a full pelvic drop. That was step one. That was just trying to figure out and play with whether or not you can bring your awareness and your mental focus down into the physical body and really kind of figure out the motions that are going on, the contraction and the relaxation, and how to make that work. Let's see if we can add some breath to this movement. So that same pelvic drop that we just did, I want you to continue to be on your back if that's where you are. I'm going to be sitting up. You can also be sitting if that's more comfortable, but I think it's best to actually start lying down. So lying down on your back, knees can be bent, we're going to do some core breathing. So what I want you to do is really bring your awareness to your core. Again, I'm seated so that you can really see what's happening with my belly as I do this breathing. So as you inhale, you're going to expand your belly like a big balloon all the way around, but really focusing not just on the front, but also the back. Think about if you're on your back on the ground, your lower ribs in the back, like under your bra strap, pressing down into the ground. Your side ribs coming out to the side. Your lower front ribs coming forward. So you're really expanding all the way around in your lower ribs, and also your abdominal belly and pelvic floor is expanding as well. All of that's expanding all the way around as you inhale. That might be different from what you normally breathe, but just try it. So as you inhale, everything's expanding. Breathing in, your lungs are expanding, which is pressing your diaphragm down, which is making everything down here expand. Now as you exhale, pull your belly button in and up. Okay, now inhale, everything expands. 360 degrees. And as you exhale, everything pulls in and up. I'm going to come onto some blocks and show you. So as you breathe in, everything expands. And as you breathe out, you feel your pelvic floor lift and your belly button pull inward toward your spine, and your breath exhales out. Now I want you to keep going with that, but try to see if you can integrate the sensation of your pelvic floor a little bit more to that breathing technique. So as you breathe in, everything expands and your pelvic floor releases and lowers, kind of like that pelvic drop that we started with. It opens, it softens, it lengthens in the vaginal area. Everything opens and expands. As you exhale, breathe out, the pelvic floor gently lifts and your belly button pulls to your spine, and you breathe out. You exhale fully and completely. So what this is doing is getting some natural motion, some rhythmic motion, which is very relaxing to the pelvic floor muscles. And it's also strengthening in a gentle fashion the deep abdominals and the pelvic floor muscle too, without overdoing it, without clenching anything or overdoing the Kegel contractions. It's really just a synergistic motion between the diaphragm, the breathing diaphragm, and the pelvic floor. They're going down together and they're going up together. And you're incorporating the corset muscles, the abdominal muscles, as you do this. So I hope you're continuing to breathe. Keep going. Breathing down into your belly, letting your ribs expand all the way around, letting your pelvic floor soften, open, and relax. You're inhaling. And now as you exhale, lift the pelvic floor gently. The main focus is really on pulling the belly button to your spine and exhaling completely as that breathing diaphragm rises up and your lungs get teeny and tiny because all the air is coming out. One more breath in the position you're in, and then see if you can transition to a different position. So one more breath in the position you're in, hopefully lying down. I think that's the best way to start. So now we're going to transition to a different position. If you were lying down, I want you to sit in a chair. If you were sitting in a chair before, I want you to go ahead and stand up. So in your new position, I want you to do the exact same thing that we were just doing, your core breathing. Go ahead and get started. Again, as you breathe in, everything expands, releases, opens, softens, relaxes, all the way around 360 degrees. And as you exhale, lift the pelvic floor and then belly button pulls inward to your spine. As you exhale, your diaphragm is rising, your lungs are getting smaller, you're exhaling. So keep going with that. And I want to explain as you keep breathing why we're transitioning to a new position. The reason why is that the general progression of really many exercises that physical therapists or personal trainers will provide people is a progression from lying down, which is usually the easiest position because you're not fighting gravity, to a seated position, to a standing position, and then to more functional positions still, such as walking around the room or other transitional movements, lunges and squats and that kind of a thing that we really need to use in our daily life. So it's a really nice progression to begin lying down, then to move to seated, and then to move to standing, and then possibly incorporate this breath into a walking around type of exercise. Now keep breathing as I tell you the next important thing. I don't want you to feel that I'm asking you to breathe this way in your daily life every single day. I think people would look at you kind of strangely if you were, really exhaling like this all day long. So that's not what we're going for here. It's not a breathing pattern that you should be using 24/7 in its full extent and to its full potential. It's really a great exercise, a gentle core strengthener and relaxation technique at the same time. And it's a really great breathing technique to integrate into your exercises. And in some cases, you will use it in certain activities during your day, such as lifting and that kind of thing. But I don't want you to feel that this needs to be how you breathe 100% of the time in the fullest sense of this word, with that full, strong exhale that makes noise and that kind of thing. So hopefully that is clear, and hopefully you're maybe finishing up with one more deep, full breath of that core breathing pattern. So inhale and exhale wherever you are, and hands at your sides. We are going to move into a deep squat stretch now. So this is a wonderful stretch and strengthener for your pelvic floor, and really great for strengthening the hips, low back, abs, and also your lower legs, ankles, feet. It's wonderful. I actually have a video that's dedicated to the deep squat stretch, and so I'm not going to spend a ton of time on this because I can link the video in the notes below, but I will go through the basics right now. Essentially, what we're going for is this right here, where you are lifted through the spine and heart. Your feet and toes can be turned out just slightly, not like this, but they don't need to be super straight ahead. And you're really opening your pelvic floor and strengthening all of those hip and core and low back muscles. So make sure that this isn't happening. No rounding, no tucking your bum under. You want to be lifted through the spine and hips. If you can't get here right away, that is totally fine. You can do some different things. You can play with putting a yoga mat between your calf and your back of your thigh, and that decreases compression at the knee just a little bit. You can come forward onto your hands. You can also put blocks behind your heels. You can sit your bum down on a low step stool or stack of books. You can hold on to the back of a chair or a couch. You can even hold on to a countertop if you just can't get down very low at all. If you're just starting out on this journey, that is fine. Do what you need to do to slowly work your way down into this deep squat position. And then I want you to try to do 3 to 4 deep core breaths, the same breath pattern we were just doing. So that deep breath down into your pelvic floor, feel the opening, the lengthening, the release as you breathe in. And then the exhale, lift your pelvic floor, pull your belly button to your spine, and exhale all the air completely out. Again, inhale, everything releases, opens, and softens. Ribs expand to the front and the back, and then as you exhale, make it loud. You lift your pelvic floor, you pull your belly button in and up toward your spine, and you exhale all the air out. One more deep breath on your own. You've got this. Deep breath into the pelvic bowl. Everything softens and expands, and then exhale, lift and pull belly button to the spine, and exhale all that air out. Now, you're probably feeling that down in your shins and your calves, so come on to your feet if you can. It's a nice little counter stretch for that deep footwork we just did. Stretch it out, and then we're gonna move up into a standing position for some hip circles. If you know me, you know that I love hip circles. These are one of my favorite motions of all time. They're wonderful for strengthening all of the pelvic and abdominal core, low back, all of the core muscles, and also releasing them. Now I'm going to show you the movement, and then as you practice the move, I'm going to tell you a really cool thing that I learned. So lift your pelvic floor just gently. Again, don't worry, we're dealing with people who have tight pelvic floors. That's you. So we don't need to be getting a crazy strong Kegel. This is just a gentle engagement. Very, very gentle. And then pull in the low abdominals, that area right above your pubic bone. I like to sometimes go shh, and that feeling of the pulling in as you go shh is what we're going for. That feeling, okay? If you haven't gotten that yet, that's what we've been going for that whole time, that pulling in. So feel that pull in and hold that as you go forward, just gently forward, like you're bringing your pubic bone forward, and then to the side, and then release everything. Let it all go as we go back. And then as you come forward to the other side, and then we're gonna come forward, I want you to see if you can begin engaging that pelvic floor and the deep abs again, that shh sensation, okay? That's gonna be engaging again here. So it releases on the way back and it pulls in on the way forward. So release on the way back and pull in and up on the way forward. Release on the way back, pull in and up on the way forward. Knees are soft, feet are wide, maybe shoulder width apart. Again, this is what we're doing, this circular motion of the hips, which can be a hard thing to get used to. If you don't get it right away, that's okay. Take your time, it'll come. So if you want to add the shh on the way forward, shh, do it at home. Shh, take it slow. Release, let it go. Shh, release, let it go. Shh, release. One more time. Shh, release. Shake out those legs, and we're gonna go the other way. So I was just going this way, so now I'm gonna go the other way, this way, okay? I was just going to the left, now I'm gonna go to the right. Do whatever is the other way for you. So while you're doing the same move, so you're going forward, lifting the pelvic floor, pulling in with a shh, and then going to the side, and then releasing on the way back, and then other side, start pulling in and up, and then release it back, pull it in and up, release it back, pull it in and up, release it back. So as you're doing this, I'm going to tell you something. There's a video I have that I'll link to, which actually showed me using a biofeedback device that I inserted vaginally as I was doing these hip circles. And it showed graphically that I was actually engaging my core muscles, pelvic floor muscles, and then releasing them on the way back fully, even slightly stronger than I could do with a Kegel, just a plain old Kegel contraction. So the circles were actually very effective, for me at least, for strengthening on the way forward and then releasing on the way back. Now it takes practice and it takes time to get the hang of this, but if you practice, I think that you'll really start enjoying this. Plus, it's wonderful for low back pain. It's helped a lot of people who have sciatica and back issues feel better. So finish up your hip circles going the opposite direction that we started with. And let it go. So I hope that gave you a starting point for tight pelvic floor, weak core, kind of exercises to get things firing up in the abdominals, the low back, and the hips, and also released and relaxed through the pelvic floor. It's a tricky combination, but it's definitely doable. And if you practice this, I would say you could do these exercises daily. You don't have to watch this whole video every time, but if you write down that you're working on first the pelvic drop, just kind of getting that figured out, that pelvic drop, and then maybe 3 minutes or so of core breathing, where you breathe down into the pelvic floor and then exhale, lift and pull the belly button to spine. So 3 minutes or so of that in whatever position works for you, lying down, then progressing to seated or standing. It's also very relaxing, so that's a nice bonus. And then you can move on to that deep squat stretch where you do the same thing. You do 3 to 4 core breathing deep breaths in that position. A great hold, about 45 seconds to a minute in that position. And then stand up and do a couple minutes of hip circles, maybe 1 to 2 minutes in each direction. Take your time with it. Be mindful and aware. The whole routine, once you've got the hang of it, should take no more than 8 to 10 minutes. And it's a wonderful way just to kind of perk up and wake up those core muscles and really improve body awareness. That mind-body connection is key. So I hope this helps, and thank you so much for watching. And be sure, if this video has helped you, to subscribe to my channel, check out my playlists, and definitely come on back. I create new videos every week, and I love hearing from you guys in the comments. And definitely reach out to me if you have any general questions. If you have any specific questions, be sure to talk to your healthcare provider. Until next time, remember, eat clean, move every day, and you will shine brighter.